All right, welcome back, everyone. I appreciate your patience. I now need a motion to open session, please.
I'll make a motion to open session.
Yes, seconded.
We have first and second. Roll call, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
All righty, next on our agenda, continuing on, is the Public Health Report. Director's Report, Mr. Sykes, you have the floor.
Okay, on our old building that we're trying to sell, I don't know if you've been by there, there's a nice big sign, for sale sign on our lot. I talked to Court, he did have a showing over the weekend, and since then, I think he had a showing Wednesday. I haven't heard how that went, but the first showing, they did want more information. There's a little interest there. And then I just now got a reply or a text that there'll be another showing coming up. So we're having some movement on that, but we're still waiting to see what happens. So in July, a few of us, including myself, went to the NACHO 360 conference down in Louisville. And it is pronounced Louisville, I believe, right? Not Louisville. They told us that's a big joke down there, how you pronounce it.
Well, it's not a joke, if they take it serious.
Yeah. So this is a huge conference. It's probably the largest conference with local public health leaders and professional health professionals. And like I said in my report, there's over 800 guest speakers and 500 sessions at this conference. So we split up and go to different sessions. A couple of sessions that the head of the deputy director and chief medical officer of the CDC gave an opening session talk. I went to a town hall session where former Governor John Kasich and former Governor Steve Beshears, who's the father of the current Kentucky governor, they did a really neat town hall on good health is good governance, and they just talked about how politics and public health, how you can work together to get things done. That was a good session, but it's a good conference. We try to go when we can every year. I think the one year it was in California at Anaheim. We didn't go to that one, but we try to go to the ones that are fairly close. I wanted to highlight some things about our communicable diseases. That's been in cyclospora. We had a talk last board meeting. A little update on that. We're in our 6th week of this outbreak. We've had about 139 cases. We currently have around 50 open cases. Still working on that, but we're seeing new cases drop. We're not seeing new cases coming in. So a little bit of light at the end of the tunnel, we hope, on the cyclospora outbreak. And there have been a lot of staff. I think I discussed this last board meeting, but we've had probably around 14 staff outside of our CD team that we have pulled in to help with these cases, and they did an outstanding job with helping work on the case investigations. And then on top of that, with all the cyclospora cases, we're also seeing an increase in our other reportable diseases. And if you'll look on the CD reports that are in your packet, you'll see that we have several alerts out. And an alert is given when there's an increase of at least one standard deviation for total cases in this current year compared to the same time period in the previous year. And all that is listed in those charts on the CD reports to kind of let you see where our case numbers are now compared to in the past. 7 of the 11 reportable enteric diseases have an alert. We also have alerts for animal bites, TB infections. It's not the flu, but it's H. flu, pertussis, and your ehrlichiosis. I always have trouble with that one, which is a tick-borne illness. So our CD team is very busy right now with all the increase of reportable diseases. And if you look at January through July of 2025, we had 469 CD cases. That same period this year, we have 1,676 reportable cases. So we've just a lot of work going on there. And then fourth thing I want to do is recognize not one of our employees, but kind of feels like she is, Tara Lang. I want you to stand up, please, Tara. Tara Lang works here in our office, and I believe there's a little picture of her getting an award. She received a 2026 Mental Health Champion Award this year, and Tara works with Chestnut, and we have a partnership with them, and she works out of our office and does a lot of work with our health navigation, and I think your title is Health Navigator, and has a lot of great stories of where she's helped individuals, and very deserving of this award. So I wanted to recognize Tara. Again, she's not our employee, but she comes to all of our meetings. We treat her, we push her around just like all the rest of the employees. And she does a great, fantastic job. And I think it's a good example of how partnering with other organizations really helps out the community. So congratulations to you. Finally, just operational update. I have been looking at the calendars for holiday schedules, and we've got that out, but I would like to be closed the day after Thanksgiving. It seems like we go through this every year, but the Friday is not on our holiday list, but operationally we can do that. I want to close Friday 27th, and the Christmas Eve is Thursday, the 24th. We'll be closed on that. I want to just let you all know that. We'll put it out on our socials, and that way staff can also plan their time as well. That's my report.
Is there any questions any questions for Steve right now? I'm sorry.
I have a question. Surprise. One, do we know why all these increases, why we have more of these communicable diseases? Oh, why there are more communicable diseases now this time of year versus last year?
Well, I mean, the animal bites have seemed like they've always been on the
Right.
increase. I don't know if you want to speak on this, yeah, that's your department. Yeah.
I'm just curious
She was
because,
hiding.
and like pertussis, you would think that would be more of a winter,
Yeah,
and
we're-
it's high like now, July, August, and why? Why is that? Do you, I mean, is there a reason why, or do we know, or?
I think there's probably a lot of reasons why. I know some of the bigger jumps in numbers we're seeing a lot of folks checking for immunity. So not necessarily actively ill today, but rubella, measles, and mumps, probably over the past 5 or 6 months, just this massive spike of people checking their titers to see if they have that immunity. All of those come in as cases to us because it shows up, it hits the algorithm of an alert to us. Some of them get
If they're not?
Yeah, they're not actively sick, but they still
Okay.
come through to us.
Okay.
A lot of them come through and they're automatically closed because our system can check that and see why. But some of them still come through that we have to call and follow up on. So that's kind of the bigger jump in the numbers.
Okay. So would we say that would be like a false negative or false positive then?
That might be more of a Melissa question. Mhm. It seems
So
like
we don't know, like, that they're sick, but it's gonna show that there's a higher number of these cases when really there's not.
Yes.
Am I correct with saying that?
Yeah, so when you
Okay.
look at the communicable disease report, which is in the packet, we've got 2 new charts on the last page of my report. So it shows the total number of confirmed and probable cases. So those are the folks that are actively sick.
Okay.
And then the chart underneath of it is that 1,600 number. And that is all of the cases that come in. So a lot of cases we investigate, and we may spend hours and hours on,
Sure,
and it ends up being
sure.
not a
No.
case. So we've been trying to have a better way to visualize what that team is doing.
And then I just had one more question. So when we spray for mosquitoes, is that also a spray for ticks as well? It is not.
Just mosquitoes.
Because there was one in here that I'm not going to attempt to say either. I have been hearing a lot about alpha-gal.
Mhm.
And it is from the Lone Star tick. And when I've done some research on it, it appears that the cases that were positive, that were reportable, are not being calculated or counted or acknowledged over the past 2 years.
Yes, so.
But there's this high increase, like what, and Missouri is like the highest number, the most susceptible to this.
I need to check because I believe the legislation went through. So everything that comes through communicable disease, there's a statute in Missouri that says what's reportable. And alpha-gal was not on that list. So up until, and I think that it did go through, but I will double
Okay.
check for you. But I think it's going to come through more, I lost my word, aggregate. So we
Okay.
may not be investigating every single case, but if there is considered a positive case, they will send it through. That's how we do flu. We don't investigate flu, but everybody that tests for it has to tell us if they have a positive. So I think that's where it started, but I will double check for you.
Do we test for that yet? Or can people come here? Because I know there, some are like abdominal pain, some are like hive rash that's only controlled by steroids, and as soon as they're off steroids, it's coming back. Like, I know there's people in the community that are really struggling, and they're, people contact me, it's like, hey, what are we doing? So, and I knew the state, it had to be at the state level, and that was kind of my thing. What, could we maybe get,
So
or I can wait till the end, like, someone kind of update us maybe next month and tell us what it is, how it works, how people can protect
And
themselves
Melissa
better.
and I had something wrote up 3 months ago, but
Okay.
I don't have it with
Okay.
me today. But we are not currently testing for it here.
Okay,
But we have looked into, there's a lot of stuff that goes into
Sure,
it. But
sure.
yeah.
okay, because I know it is, like, it's starting to become an issue, to me.
It'll be
From what I'm
very
hearing.
interesting to see what those numbers look like.
Yeah. Okay, thank you, appreciate it.
I noticed that measles wasn't on your list. Is it just that we don't have any high cases?
I can't believe you said that out loud. As of this very moment, I do not know of any cases of
Okay,
measles in
that's a
Jefferson County.
blessing.
I don't want to jinx us. It's something that we talk about often. Just today, there was a call with the state that we went through. On the preparedness side, who work directly with the communicable disease, we talk about it often and we kind of practice. Cyclospora, we modeled just off of our measles protocol, so that's how we pulled people in. We did just-in-time training to make sure everybody was trained on how to do those investigations and follow-up. In that case, it would be getting contacts as well. But as of
No reported.
right now, we're good.
Because I noticed, I thought I read that the cyclospora, we were up to 2,000 cases. So that's pretty much truth, you know?
For Missouri,
Yeah, from Missouri.
we've
Yeah.
got 139. Normally, it's us and then the bigger metro areas, so that seems like a plausible number to me. That's the number that I see on the state website when I look at the
Okay.
database.
Thank you.
Have you heard any explanation why cases continue despite what they think was the cause have been taken off the shelves?
I don't have any of that information. I know that anecdotally, when we look at all the cases, most folks were from that 1st of July time period. I think some folks wait a while to be tested, so I think that's why tests kept coming through. I don't think it's a fun test.
So if you're like, I mean, we still have open cases, that doesn't mean they just came in, they still be from that, fall in that time frame. We just haven't gotten,
Yeah,
with the caseload, they haven't been worked yet.
it just seemed like they continue to have cases reported. But yeah, so that could be why.
It seemed like there was definitely at least a 2-week time period from when people were getting sick to when test results came through. And so for some people, it's even longer than that.
Yeah, right. Okay.
Is there any other questions? All right.
No kidding, no kidding.
Next on the agenda is discussion of mental health safety net in Jefferson County. This was requested by Ms. Brown Taylor. So the floor is yours.
Hey, can I just do it at my seat?
You can do, if you want to stay at your seat, you can just go ahead.
Okay, originally I wanted to just kind of highlight Jefferson County, and I kind of still do, but the fact that mental illness and mental health events are happening more and more within Jefferson County. I know most communities would agree that we need more accessible services, especially in current state of the world. So funding cuts have reduced a lot of professional staffing in some instances, or lack of insurance. And then other factors create mental health crisis events, such as turmoil within our lives, et cetera. So I thought maybe understanding the scope of the problem and the gravity of the illness was, I won't say lacking, but sort of not on a higher end of other mental problems, or other mental health, or other just health problems in general. So I had talked to somebody at Compass, and I did some interviews at some other places, and it seems that a lot of them agree that it's the funding, basically. We all know that it's vital to any community health program. So I do know that agencies, I did learn through the research that agencies do work together, federal, state, and local agencies, promoting mental wellness. I found that they do sponsor toolkits, education to reduce the stigma, because a lot of people don't seek help because of the stigma, and promote prevention and early intervention processes. So I think some of it, I'm not a clinician on mental health, but I did find that that I didn't know about the 30-day rule, where anyone who has an emotional behavior episode or issue would be under that 30-day rule. And a lot of times it's temporary, because, you know, somebody might have a life upset, a job loss, breakup, or grief, or just low self-esteem, or just irrational worrying about something. So they usually wait for that 30 days, because it might just be temporary. It might not just be something that they need intervention with. So they wait for that little adjustment period. So then there's law. You just can't pick somebody up off the street and do mental health on them, you know, or prescribe them medications, or detain them without their approval. But if there's someone that is involuntary, not wanting treatment, that's what that mandatory review period does. And if they're not willing to seek treatment, then they are reviewed by a government independent doctor before any non-consensual meds or anything are given to them. So we all know depression increases the risk of chronic conditions, and I learned that diabetes, stroke, heart disease, and generally chronic diseases increases the risk for developing a mental health condition. Didn't know that. So working with kids with disabilities, behavior disorders, myself for the last 8 years, there is a correlation, I think, sometimes between mental health and behavioral health issues. So I did the research and found that the National Institute of Health, they support a phase-based care within community facilities. And didn't quite know what that was all about, but they're trying to push in community health organizations to see more mental health patients, because they said there's the cost effectiveness for it. There's they can use algorithms and rating scales, and then they can use treatment teams for depression and managing someone's depression. So I thought that was pretty important for the phase-based care, but that's just a partial solution. That's probably within some reach of some community mental health organizations, and the federally qualified ones as well. So supposedly, going that route, you don't need additional staffing, you do better engagement of patients, not a lot of delays, and possibly increase your revenue by reducing the no-shows that sometimes you have for different appointments. So although the implementation would give community health organizations the ability to modify or to eliminate the traditional practices that they use. So I think it's, you know, we're well aware that we should encourage Congress to fund mental health prevention and early intervention. So there's 4 C's of mental health issues, or people who are trying to build emotional stability for their well-being, and that's connection, communication, coping, and confidence. So those are the 4 things that really help mental health situations that someone's going through. And there's 4 main types of mental health. Of course, we all know the mood disorders. We all know the psychotic disorders, the anxiety disorders, and the personality disorders. So it could be any one of those. So the disciplines that we have, the therapists, the counselors, they all play a part in the diagnosis, treatment, and the care and management of a mental health patient. And there's many families now in crisis and turmoil, or even trying to understand the scope of any mental health issue or illness that their family member or themselves might have. So recently, as a few days ago, weeks ago, I get a crime radar on my phone, and it covers Jefferson County Fire and EMS reporting, and they give you audio, little audio of that. And listening to that, you can tell there are psychotic and anxiety disorders and things that are going on with our residents and our youth as well. So they have responded to suicide attempts, and this is, true. Suicide attempts, unconscious individuals or agitated family members. So I feel as though that those issues are on the rise. Also, I think Jefferson County does a good job in focusing on our mental health resources, accessing treatments that are available for patients, and trying to do early interventions as much as possible. So I learned a great deal with that. I think I'm much more aware of individual behaviors and the stressors that people go through. So also, I want to give a shout out to Tara Lang, who kind of pointed me in the right direction on what was going on in our community as far as Hope is Here campaign, which is the coalition between many different organizations here, a lot of them, including Chestnut Health, Compass, Dunklin School District, which is who I'm with, Prevent Ed, Provident Behavioral Health, Jefferson College, Vikings Care, Jefferson County Mental Health Fund Board, Annie's Hope, Atlas Youth Outreach, Aspiring Solutions, Crisis Aid, Good Shepherd Children and Family Services, Presbyterian Children and Home Services. So I think there's, within our community, a lot of organizations that actually are helping and working toward addressing our mental health issues. So, and also tips for parents and caregivers, because caregivers go through a lot of anxiety, and parents as well. So addressing the youth and caregiving anxiety and distress, I think, is very important within our school system, and that's what Tara and Chestnut does too. So thank you.
Thank you. Does any of the board have any questions?
Do you have any comments, Tara?
Okay. We'll now move to the next section, public comments. I don't believe there's anybody here looking to make a comment at this time. There is no old business, so we are on to new business. And the first of the new business, I get my stuff right here on my computer. Sorry about that. And this is to act on recommendation to approve settlement agreement in the cybersecurity case. Do I have a motion, please?
I make a motion that we approve the cybersecurity settlement case.
Do I have a second?
I'll second.
All right, I'm going to read the first part of the resolution at the top, just the very top. So this is a resolution to approve the settlement agreement and authorize payment in JD et al. Versus Jefferson County Health Center, DBA, Jefferson County Health Department, Circuit Court of the City of St. Louis, case number 2622-CC00457. So we have a first and second for the approval. Are there any further discussion points on this matter or comments? Not hearing any, I'm going to request, of course, a roll call vote.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
This motion is passed. Next on our agenda, pull it up again, is act on recommendation to approve release agreement in the broker personal injury case. I need a motion for this, please.
I make a motion, we approve the release agreement in a broker personal injury case.
I'll second.
We have a first and a second. I'm going to read it, then I'll ask for comments if there are any after this. So this is a resolution to approve the settlement agreement and authorize payment in Broker et al. Versus Jefferson County Health Center et al. Jefferson County Circuit Court Case Numbers 24 JECC 00641 and 762. Same prefixes. Are there any comments, questions, discussion points on this one? All right, not hearing any, roll call, please.
Mr. Pig?
Yes.
Dr. Henry?
yes,
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Steve, you're gonna have to thin these out a little bit, buddy. Second, the next on the agenda is second reading and act on recommendation to approve access to Jefferson County Health Center facilities policy. I know that this was second reading and everybody had the opportunity to make comments and they were, I don't think there was any given. So I need a first and a second on this one, and then I'll read just part of it and then we'll move forward for a vote.
So you need a motion to recommend, or
To read, for the approve the second reading.
to approve it? Are there gonna be two?
This is the second reading.
Okay.
Okay, are there two motions?
Well, we need, no, we just need one motion to the second reading and act on recommendation to approve it. That's what
Okay.
we're doing.
So moved.
Yeah.
Okay.
So I need a motion, please.
So I make a motion to act on the recommendation to approve the policy. That's what I said, right?
We need a motion to approve,
Access.
we need a motion to approve the access facilities policy. All right. So that's your motion, correct, Mr. Deal?
Yes, sir.
Do I have a second?
Second.
All right, having the first and second, I'll read portion of this, and then we'll come back to discussion if there is any. This policy establishes rules governing public access to Jefferson County Health Center facilities and expressive activity on the Jefferson County Health Center property in a manner consistent with the First Amendment, Missouri law, operational needs, public safety, and the efficient conduct of government business. All right. Are there any discussion points? This is the second reading. Are there any other discussion points or questions, thoughts, comments? Not hearing any, roll call, please.
Mr. Pig?
Yes?
Dr. Henry?
yes,
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
All right, the next one, this is the first reading, and this is to approve the Jefferson County Health Center Artificial Intelligence AI use policy. And I know we just got this over this week, but again, this is the first reading, so we'll have a second reading. We've got plenty of time to put in things, comments, if we wish to forward. It's pretty lengthy, and this will be an ever-changing situation, as we all know. So I need a motion, please.
I make a motion for the first reading of the Jefferson County Health Center Artificial Intelligence Use Policy.
Do I have a second?
Second.
And I'll make a reading as soon as I can get to it. There it is. All right. The purpose for this policy is to establish clear requirements for the responsible, secure, and compliant use of artificial intelligence tools at the Jefferson County Health Department. This policy is intended to ensure that AI technologies are used in a manner that protected health information and confidential data, complies with HIPAA, Missouri law, and Missouri Sunshine Law, supports the department's public health mission without introducing unacceptable risk, and maintains public trust, data integrity, and ethical standards. Is there any thoughts and questions on this at this time? I know we're gonna have time, but I didn't know if there was anything that kind of stood out other than AI's here and it's gonna get worse or better, however you may seem that. So we have a first and second. Not hearing discussion points, roll call, please.
Can I-
First, yes, sir, I'm sorry.
So has AI come into play in anything we've been doing so far?
Well, I mean, I won't bore you with all my knowledge of AI, but I asked Steve to come in. Yeah, I mean, AI is here, we are using it. Actually, at this conference, there was discussion on how AI in public health can be a really great tool. The big thing that we're concerned about here is we have a lot of PHI, and how AI and PHI really don't play well together. So even without PHI, you need to have some type of policy on how AI works within your business. But with PHI, it's even more important. So, I mean, we see it in creating documents, creating spreadsheets. It's a very good tool for doing that. So that's where we're seeing mainly being used. I don't know, Steve, is there any other areas that we're using it?
No, currently right now,
I thought I did pretty good, but you may. And Steve did work on putting this together, and we reviewed it with the admin team, and then, of course, Christie did review this policy as well.
check. Okay, I'm on. Yeah, Dennis, so really, we don't have a choice with AI at this point. It's in all Office products. Microsoft has pushed that into everything that they do without our explicit approval of it. So with that comes some security measures that we need to put in place to make sure that our staff know, one, it's going to be in everything, and then to look out for new entities, like whether it's our EHR applications, other third-party vendors that start using AI on their side. It was a way for us to become more aware that it's kind of everywhere now. Does that answer your question, or did you want me to expand on that?
No, I was just curious. It makes sense to me that it's used in a lot of kind of word processing or information kind of thing.
Well, and
So-
it's built into even so much as a calendar for your Outlook now, where it'll give you, here's free time on everybody that you're trying to have a meeting with, and it'll pick out the date for you. So there is a lot of extremely good uses for it. But again, we wanted to create the policy to protect from some of the bad parts of it, so.
Yeah, okay, no, that's great, thanks.
So we do have certain parts of Copilot enabled, but it is very much locked down on the back-end administrator side of it. So nobody has the ability to alter things or change things within the Copilot environment, but we do just have the free version right now. Okay. Yes, ma'am.
So, how are you able to separate the PHIs from, integrating with AI?
So that's really the importance of this policy,
Okay.
is so our staff explicitly know that that is not a JCHD policy to mix PHI with any AI systems. At the end of the day, humans are humans, so you can't stop
Error.
everything from happening.
Yeah.
But that's what the policy is for, so we don't do that. And then we can't stop third-party vendors that choose to put AI in their systems. We don't have any control of that, unfortunately.
Wow, thank you.
The awareness is the key.
Correct.
All right,
Thanks, Steve.
any other questions? So this is to approve the first reading, which I've already read. Roll call, please.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes,
Ms. Taylor?
Yes.
I think next is, Mr. Crawford, do you need to get in on this, or? Act on recommendation to approve fire and security alarm upgrade. I think that's all you're doing, isn't it?
Well, we just had one bid that came
Oh.
in. The review that Steve did is in the packet,
All
so.
right, hold on. So let's get a motion and a first and a second, and then we'll have a discussion on it, okay? So do I have a first to approve this? The upgrade for it's in the Arnold Health Department, right?
Correct.
Fire and safety for the Arnold office. Do I have a first?
I make a motion, we act on the recommendation of approval of a system for Jefferson County Health Department Arnold, the fire and alarm system upgrade.
So first to approve, do we have a second?
Second.
First and a second. All right, now let's go ahead and discuss what we need to discuss. And filter out what we need to filter. What are you looking for?
Well, the bid that we received did come in within the budgeted amount that we put in. The one thing, the total cost is I can't find it, 28,000. I can't find it, Steve.
75.
It's in the packet, I think. And this is to upgrade our current burglar and fire alarm system in the Arnold building. It's the original, which was, what, 2000 when you built the building? 1999, 2000? Okay.
So I think you were showing some concerns to me earlier.
So one of the things that, anytime you go in and retro a system of any kind, you may run into some unforeseen issues. And so I talked some to Christie as well about this. I would like the ability that we accept the bid that they submitted with knowing that if there are unforeseen things that come in, that I have I can go with above the budget or the bid amount up to the budget of 30,000,
Okay.
which
What was-
should.
What was the budget amount?
30.
We budgeted
30? Okay.
I was a little confused on this, Steve. So you have, one column is the bid, and then the other one says estimate of existing devices? What is that?
I went through and did a visual account of what I believe is being referred to in the bid. I can't for sure say I've got all relays located, because sometimes relays are hidden, or they're non-existent. In some cases, they may have to install additional relays for what they're installing. So that count is based upon my visual count of what I see in the building.
So you feel they're short.
So they,
What do those amounts mean? Is that,
which amount?
well, you have
So I
price.
counted like, in our, for example, our pull stations, I counted, I think it was 9. It's less pull stations than they say we have.
Right.
So, but there's one, or actually 2 additional duct smoke detectors that they did not count. I found 2 additional.
So they're short, basically, is
They're
what you're
short
saying.
two
You
duct
feel that it's gonna be,
So
I
there's
get
gonna
it.
be some that we won't
Sure.
install and some that we will. So there's gonna be a little bit of a variance in the actual
Oh,
amount.
Okay. So you're taking the price that they quoted for the
Right,
equipment that, okay.
right. I'm using
Right.
that to help determine what the real amount will be,
Right, okay.
but knowing also that I'm not a fire alarm installer, I'm not a burglar alarm installer. I've just spent all my time with these folks when they do their testing and all various alarm tests, so I can spot a lot of that. I know 3 heat detectors. They say there's 4, but I only find 3. So,
So we're just trying to make sure that we're making sure we can cover, because the work's gonna have to be done, but I don't expect, I mean, if we see that they come back and say, hey, this is too much and this system is not going to work, then we're gonna stop and refigure what we're doing here, whether we have to go out for another bid because the scope is way outside of the scope of this bid, we would do that. But I don't think that it's just gonna be more of finding the devices in the older building. So their bid is 28,705, is that what?
Yeah.
Yes.
So do we need a new motion to approve it up to $30,000?
Yes, yeah. And so basically, if it falls within the scope of what's already delineated in the bid, then we don't have to go out and rebid it. If it's something that's completely outside the scope, then obviously we're gonna.
All right.
What Steve is saying is, if it falls within the scope, but it raises the price, I wanna be able to move forward as long as I'm not going over the budget of the project.
But should we be approving to accept the bid?
You're moving to approve the bid, and so the motion would be to approve the bid and to authorize the executive director to expend up to the budgeted amount for the project for any unforeseen items.
Of 30,000. Okay,
So moved.
Which is 30, is that right?
it's 30,000, yeah.
Was there a fire inspection that was done that made you think that
We
the whole
do.
system needed upgrade?
We do so we have an annual fire alarm inspection in the Arnold building specifically every year. And to build towards that fire alarm inspection, I have the alarm system inspected every year. I have the elevator inspected by law, that's required by law every year. I have the fire extinguishers have to be inspected every year. There's all these different pieces that come to fruition through the fire alarm inspection to prepare for that. We'll be doing that for this building as well, which is probably a newer scenario than we've had. We've done it with the old Hillsborough building. We're yet to do it with this building, we're going to. In that process, one thing that became very apparent early on was when they put that system in, they put in a fire alarm panel. And then either subsequent to that or at the same time, I don't know the history because it's before I took on this position. They put in a burglar alarm panel and they tied it in through the fire alarm panel, which is a no-no. You don't do that nowadays. So the standard is to have your standalone fire alarm panel, which is not on your burglar alarm, and then your separate burglar alarm with all your supervisory alarms on two different panels, standalone, separate, completely untouched. That way if something happens to this one, it doesn't address anything with this one. So that's one issue. The other issue, we had a scenario involving one of the keypads where it was damaged, and we called them in for a repair, and it took a couple hours of researching where everything was, and when they made repair, it wound up just being loose wiring, but they informed me that the keypad, if we lose the keypad, we lose the system, because the keypads are no longer available. And these are analog keypads, so when I put someone into the system, I literally program them phonetically, if you will, or I forget what the word is, but I'm using numbers to program letters. And so when I put a person into the system, I won't be able to do that if we lose all of our keypads. So if we lose them one at a time, our entry location potentially could change. You can no longer enter at this door, you have to go at this door. So that's gonna become a potential issue over time. So I'm trying to get ahead of that by upgrading our system to something that's actually similar to what we have here, so that we have even the ability to remote check our building if we have something happen. Which I have done here, actually, since we moved in.
All right, so I'm gonna take a shot at putting together a, so, a motion to approve the fire and safety, who's the name of the bid?
Burns Citadel.
Burns Citadel, okay. So we're gonna approve the fire and security alarm bid from Burns Citadel upgrade for $28,705. And we're also gonna authorize the director to spend up to $30,000, not to exceed, for unanticipated issues as long as it is within the scope of this project. I'll make that motion. Does anybody want to second it?
I'll second. We'll get on
All
that.
right. Is there any further, I'm pretty sure it covers everything. Is there any further discussion on this? Not hearing any roll call, please.
Mr. Pig,
Yes?
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
You're exceeding the brain power. Okay, next is the Jefferson County Health Board meeting dates for November, and December. I guess you want to discuss those?
Oh, that's me. Yes, so we do this every year because of how the holidays fall. So Jetty left me a note. They were looking at, for the November meeting, either the 19th, 23rd, 24th, or 30th. And those dates are to make sure that accounting has enough time to get all their reports in.
It doesn't matter to me.
Can you repeat those dates?
Yeah,
Thursday after Thanksgiving?
I don't know where they fall.
The
It's the 19th,
30th.
23rd, 24th, or 30th.
30th would be the Monday, obviously.
23rd, yeah, it's a Monday.
Yeah.
23rd and the 30th.
Yeah, it doesn't make me any difference, so it's up to you
Mondays are
folks.
tough for me, but I mean, because I work Sunday nights.
We can do it on the 19th, the Thursday before, or is
So
that?
early though, right? I mean, wouldn't that just be 3 weeks after the last one? I guess it has to, they're all gonna either be too close or too far.
Mhm.
The big issue with us was, with Kristen, and these dates, we checked with you, you were okay with these dates.
Is it better later for you to get everything ready? I mean, I just gotta wake up. I said I just have to wake up to get here right before, but is it better to have it later in the month or earlier?
I mean, either way.
So,
Like I said, it makes me no difference. I'm sure it doesn't you
Same
much.
here.
I have nothing scheduled.
Are you okay, anything?
I have nothing scheduled the 19th or the 23rd or the 30th. So,
Amber, what about you? You okay with all those dates?
so far.
Yep, okay. So
Yes,
it's-
they fine.
It's all on you, Tammy.
Well, 19th actually is better for my personal life.
The 19th is
My
better?
sleep, yeah. You
19th?
know how I roll in here.
All right,
After
so the
working
19th
all weekend, I'm not really functional on Monday.
November 19th is a
Thank you,
Thursday,
guys.
all
I
right.
appreciate it.
And December, let's roll, yeah, same time.
Fourth?
Let's roll with December. What are we looking at for December?
So December would be the 22nd, 23rd, or 28th. So that would be the Tuesday, Wednesday before Christmas, or the Monday after.
Again, it makes me no difference. I'm fine either way.
Can we vote on the 19th?
That's a Saturday.
I'm not doing Saturday.
December.
Oh, December.
Well,
Sorry, I moved forward. December.
I can do the 28th if it works for everybody else.
28th, how's that work for everybody
Since
else?
you guys are giving me one day, I can stroll in here in
We're
pajamas.
good there?
Yeah, so,
Valerie, you okay? 28th?
December?
December?
On Monday.
Yeah, that's fine, that's fine.
Okay. I assume, Dennis, you okay with
It's
that?
on a Monday after Christmas.
It's the Monday after.
Yep.
right? Yeah, no,
All
that's
right.
fine.
All right, so there we are, the 28th. All right. Cross that off my list. All right, next is the CDC.
19th is the 19th.
Okay.
November 19th
Okay,
and
we're good.
December 28th.
You'll send out, somebody will send out invites, please.
Yep.
FDA. Well, they'll just have to move.
I think we can probably move that one. Probably.
Oh, on my
Think
day.
we control this? FDA, CDC, anything?
No updates at this time.
Nothing, you said, sir?
Correct, nothing.
Okay, all right. Is there anybody, any of the board members looking for entertaining topics for the next agenda? All right. Not hearing any, I'm looking for a motion to adjourn, please.
You mentioned Alpha Gal. Are you wanting a discussion someone brought in?
Could we just, to see what, didn't you say they were gonna be putting that on a thing and
If-
kind of like where people go? I know that a lot of people in the community are just randomly being diagnosed. like,
But that's a
how, who,
topic.
yeah, could we do that? Just like, where would they go? How are they treated? What's working? How?
Put that
yeah.
on the,
Know that.
And just an
page?
info thing on it, because a lot of
Yeah, we
people are
could
being
do
diagnosed with it.
All right, we can just put it on the report.
Sure, sure.
Is that all right? Okay.
Great. Thank you.
Motion to adjourn?
I'll make a motion to adjourn.
A second.
First and second, all in favor, please say aye.
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 Any opposed? Motion carries. Thank you, folks.
Oh, I didn't, it just one's me. I'll